So you've recently been diagnosed with vertigo, but you don't actually know what you should do about it. Hey everyone, this is Dr. Heather, your virtual sports chiropractor, and I want to go over the 3 types of vertigo that you may be experiencing, and then I want to look at some things that you can simply do at home to kind of help with that vertigo. So the first one I want to start with is known as benign positional vertigo. Now in this situation here, from the diagram you can see on the screen, this is one that's very common, and if you're experiencing vertigo, you may be saying, wow, I feel the room spinning versus me spinning, and that's very common with benign positional vertigo because what's happening is every time you change position, usually from a lying to a seated position, sometimes lying to standing really quickly, you'll feel the room spinning. Now this simply has to do with the fact that inside the ear itself you have little hair follicles and little calcium crystals that sit on the inner ear hair cells. And when these calcium crystals fall off, it throws off your equilibrium, meaning your balance, to give you the sense that the room itself is spinning when it really is not. Now you might be thinking, wow, that really kind of sounds awful. Well, a lot of us may experience benign positional vertigo, especially during seasonal changes. So if you live in the Northeast, if you're in like Chicago, which is also known as the Windy City, you may experience benign positional vertigo, especially in the winter months, because of those wind conditions and wind itself knocking off those calcium crystals in the inner ear. This is why a lot of times, if you are someone who suffers with benign positional vertigo, your doctor may recommend ear muffs or to wear a hat during the winter season to really kind of prevent this symptom from occurring. Now the next one we can take a look at is known as acute Labranitis. And you might be thinking, wow, what is that exactly? Well, from the diagram that you can see on the screen of the inner ear, the labyrinth itself is all of this kind of tubular membrane that you're seeing inside the ear. And what happens with acute Labranitis, this is more of known as a vestibular neuritis, which is an inflammation of the balance apparatus of the inner ear. And it's usually kind of more caused by a viral infection. And that's when you can really see more inflammation, irritation in that ear itself. Now the next one is actually a little bit more of a severe case, which is known as Menieres Disease. Now Menieres Disease may require more physical therapy with somebody who really does specialize more with this type of condition, or may require eventually surgery. But in Menieres Disease, as you can see from the diagram above on the screen, Menieres Disease is usually a lot of repetitive episodes of dizziness, and then you usually can have ringing in the ear and then a low frequency hearing loss. This one a lot of time is due to the fact there was a buildup of fluid inside the inner ear, and that is kind of why you're noticing this type of diagnosis. Now again, these are the 3 common types of vertigo that you may be experiencing. Now if you do have Menieres disease, or your doctor did state that, what I'm going to mention in terms of something you can do that's simple and basic may not really help you with Menieres disease, simply because that might require you to be using a physical therapist that really does specialize in that condition a little further. But as far as somebody with benign positional vertigo, or even just a little bit of an inflammation inside the ear, as always, I talk about, using myofascial work to kind of really break down the tissue. Well, you could actually go ahead and simply lay your head on a foam roller and allow for the suboccipital area, right where the suboccipital condyle is, and allow for some pressure to be placed in that area. You could start kind of breaking down the tissue a little bit, and then taking an ice pack and actually placing it there, because with anything that we do when we break down the tissue, you may notice a little bit more inflammation in that area due to an increase in vascular flow. Now the ice will go ahead and allow for that area to cool down a little bit, but also may go ahead and stop the room from spinning, just simply because now you're also kind of quieting down the nerve and any irritation to the nerve roots at that point. Again, something with benign positional vertigo, usually you do work with a PT as well because you want to retrain your ocular movements, and that's really kind of doing some different things with the eyes. And then also too, chiropractic adjustments have helped with benign positional vertigo. And in terms of acute labyrinthitis, you may actually need more of an antibiotic if it is resulting that of an infection or more of a fluid buildup. But again, those two, if you did see a chiropractor for, may actually help and aid in reducing that vertigo symptom. And if you found this little video helpful on the 3 different types of vertigo that you may be experiencing, give it a like. And as always, don't forget to subscribe to the channel. And if you have more questions regarding your vertigo symptoms, do leave those comments down below. All right, everyone, I'll catch you in the next video.